Hello friends, I am Dr Sourabh Patwardhan from Nandadeep Eye Hospital, Sangli, Maharashtra, India. We have PG Teaching Institute and we train many of my colleagues in surgeries like phaco and SICS. Now in this video, I am going to speak about how not to punch hole during trenching. I think it is one of the very common complication done by the beginner phaco surgeon. So let's begin with the thought process. Here the surgeon is ready to do the trenching. It's a soft cataract. So now let's look at which area where we should trench. So when we find the central circle of 5 mm, I call it the business area because you have no business outside this area when you are doing trenching. You have to focus only in this central 5 mm zone, and that is one of the commonest mistake. So what is the ideal trench like? If you see it from the cross section, the phaco probe must move in a curvy linear fashion and not a straight direction. That is because the posterior capsule is also curved. So in the center it should go deeper, while moving towards periphery it should come more anterior. Because if you go in the straight line, which is a wrong way of doing trenching, you will find that peripherally the posterior capsule is quite close to the phaco tip and can rupture. As we want the nucleus to crack from the center, it has to be deeper in the center as compared to in the periphery. Otherwise, the nucleus splits in the periphery but stays together at the center unsplit, and that leads to further problems. Now let's look at what this trainee is doing, and you can also hear the trainer instructing the surgeon to stay in the central area. So here I think fairly adequate depth is achieved. Generally 80% of the depth is quite good enough for all types of cataract, and you don't need to go to 90 or more percent because there is always a chance of rupture. So the eye cannot be kept in the primary position by the trainee. Both the instruments should be at the deepest part of the plane. That will help in easy splitting of this nucleus. Though of course for very soft cataract like this, trench divide can be little bit difficult. Now as you can see, the eye moves from the primary position and the trainee starts in far periphery rather than starting from the center, which the trainer is instructing the trainee to do. Again the trainee reaches out in the periphery, and as you can see from the glow as well, that the tip or the phaco probe is reaching quite deep in the peripheral area, and there is a high risk of touching the posterior capsule here. But luckily the posterior capsule is safe so far, but as you can see the technique was little wrong. And again here you can see the trainee starts in not in the center but in the periphery, and again the eye leaves the primary position, and many times that causes misjudgment where the probe is, and now there is a punched hole right in the periphery of the nucleus. So as I said, it is very important to keep the eye in the primary position, work within this business area, follow the curve rather than going straight. Foot switch control for power delivery is essential, and for soft cataract like these, use very minimal phaco power. You can set it in your machine rather than punching through the nucleus. For more such videos, do subscribe to my YouTube channel. Thank you.